Greetings, everyone. Welcome to, my name is Nikki Garro, and I'm Director of Early Childhood Health Programs at Child Care Aware of America. Over the past week, we have released a variety of resources urging childcare professionals, children, and their families to help prevent flu by getting vaccinated. Today, we're honored to share a conversation between two accomplished healthcare providers who will discuss the importance of parents of young children receiving a flu vaccine. This conversation will complement our blog post on this topic, as well as a variety of other resources that you can find on the Child Care Aware of America website at childcareaware.org/flu. Before we begin, I'd like to share a little bit about our speakers. First, Dr. Jocelyn Slaughter is a board-certified obstetrician and gynecologist who is the founder and CEO of The Healthy Woman, which is a health practice providing comprehensive women's health care in Georgia. Originally from Chicago, Dr. Slaughter graduated from Howard University and the University of Chicago Pritzker School of Medicine. Dr. Slaughter completed her residency at Grady Memorial Hospital under the Morehouse Obstetrics and Gynecology program. She is happily married and has two beautiful daughters. She loves caring for women through all stages of life. And with her, we have Miss Krystal Adams. Krystal Adams is lead nurse practitioner at CareMore Health Touch. She is a certified acute care nurse practitioner with a postmaster's in gerontology. She takes great pride in anticipating the needs of her patients and matching the care they desired to the care they received. Originally from Maryland, Krystal received a Bachelor of Science in Nursing from Howard University and her master's degree from the University of Maryland, Baltimore. She went on to obtain her postmaster's in gerontology and her wound care certification. Krystal's passion is wholeheartedly for her patients and treats every patient as though they are her family. In addition to constantly learning, Krystal enjoys spending time with her husband and two children. And with that, I'm going to turn it over to Ms. Adams and Dr. Slaughter to talk to us more about why it's important that parents get their flu vaccine this year.
All right, welcome everyone. As Nicole stated, we will be talking about the flu, and I have a lot of questions for you, Dr. Slaughter. I hope that you are ready. So we're going to jump right in.
I am ready. I'm ready. I'm ready.
Awesome.
I love to answer questions for moms and parents about the flu vaccine.
Awesome. So our first question is, what is the flu and how does it generally spread from person to person?
So influenza, or the flu as we call it, is a respiratory illness. It's spread by people sneezing, coughing, and those droplets being absorbed by somebody else's mouth or nose. Sometimes it can also be spread by somebody coughing on their hand, touching a table, and somebody else touching that same table and putting their hand in their mouth or their eyes. It's very easy to be spread. So that's why it can be a really big problem, especially during the winter months.
So I know that we tell our patients all the time that they need to get the flu vaccine. What do you say to them when they say, I don't get it, I haven't gotten it in a year, I don't want it, and I'm not going to get it?
So getting a flu vaccine is not just to prevent you from getting the flu, but it's to prevent people who are most at risk. The more people who don't have the flu, even if it's a very mild version, can protect people who can get really, really sick from the flu, especially pregnant women, because their immune systems are lower because they have foreign DNA in them, and young children, especially under 5. If they get the flu, they can get really, really sick, and the elderly. So getting a flu vaccination is not just for you, it's for everybody.
I love that. What are some of the symptoms you generally see in someone who has the flu?
The symptoms can really vary. It can be a fever. A lot of people feel really, really tired and weak, sore muscles, stuffy nose, sore throat. Those are some common symptoms of the flu. If it gets more progressive, people can get shortness of breath, difficulty breathing, and fevers that can get really high and cause seizures or other abnormalities. So it's a wide range, but usually it always has a fever and body aches involved.
We know, I think most people know that it's really important to get the flu vaccine, but can you speak to why it's so important now that we're in the midst of COVID-19 pandemic?
Yes, it is really important to get the flu vaccine now. A lot of people are going to be confused on if they have the flu, if they have COVID, and the more people that don't get the flu, the more we can better help people who have COVID. Testing in a lot of areas for COVID-19 is limited. So if more people get the flu vaccine, less people will have these common symptoms that the flu and coronavirus share. So it's really important to get as many people vaccinated so that we can keep our attention on the people who have COVID-19 and make sure that they get properly tested and treated.
I love that. I think most people don't know that the flu season starts in September and it goes all the way to March of the next year. So who should get vaccinated during that time?
Well, everybody, anybody who's 6 months and older, the CDC recommends to get a flu vaccine. Sometimes pregnant women are a little nervous about getting vaccines, but we recommend getting the flu vaccine for all my pregnant women at any trimester. Again, pregnancy is a time where our immune systems are decreased, and it's natural because we have this baby inside of us that has different DNA than us. Unfortunately, that decreased immunity exposes us to the flu. And if we get it and you're pregnant, it can be devastating. The worst flus I've ever seen has been people who've been pregnant. Children, again, over 6 months can get it. People who work in the healthcare field, you definitely should get it. People who work in schools and anywhere where you're around people, you should get a flu vaccine.
And where can you go to get vaccinated?
Your primary care physician is the best place to go. However, during this season of COVID, it can be very, very difficult to get appointments. There are different pharmacies that offer flu vaccines that can use your insurance. And then a lot of health facilities like hospitals offer their own flu shots to their employees.
All right. In addition to getting vaccinated, what are some other ways to prevent the flu?
Trying to stay as healthy as possible. So, hand washing. You should wash your hands before you eat, after going to the restroom, after coughing, after sneezing. So, hygiene is number one. Also, if you do cough or you do sneeze, covering your face with either your arm, your hand, and then washing that right after. A lot of us are wearing masks, so that's awesome, but you also need to wash your mask periodically because you're constantly coughing those particles into that mask. And the biggest thing is if you feel sick, stay home. The more you go out and you're around people, that's the way the flu can spread. So if you're sick, if your child is sick, stay home until your symptoms have resolved, and then you can resume activity.
And that magic amount of time that you're supposed to be washing your hands is 20 seconds, no less than 20 seconds. So sing a song if you have to, is what I tell my patients. All right. Can someone get COVID and the flu at the same time?
Yes, I definitely agree. Unfortunately, yes, you can get COVID and the flu at the same time, especially since some of the symptoms of COVID are very mild and some people's courses may be very mild. You may test positive for COVID and also have the flu. So that can be very difficult as providers. We're in uncharted territory this season to differentiate who has the flu, who has COVID-19. However, the recommendations are still the same. Isolate, and if you have any difficulty breathing, then you need to go to a health professional.
Jocelyn, are you familiar with any contradictions where you cannot get the flu vaccine at all?
Yes, If you have had a previous reaction to a flu vaccine, then we don't want you to get a flu vaccine. Some people who have severe egg allergies can sometimes not be able to get a flu vaccine. However, generally it's very well tolerated in people 6 months and older. So if you have any questions about if you should get a flu vaccine, chances are the answer is yes. But to be sure, talk to your healthcare provider or anyone administering you the flu vaccine. They will make sure that you're a candidate for the vaccine.
Awesome. So we've talked about why the flu vaccine is important. We've talked about who should get it, where you can get it. It's important to get it every single year. Jocelyn, is there anything else that you would like to add?
I would really like to stress the importance of getting a flu vaccine. I think many people decide not to get one because they've never personally had the flu. And there's a big myth that if you get the flu vaccine, then you'll get the flu. That is simply not true. And during this year of this global pandemic, it's even more important for the population to get the flu vaccine. Physicians, we're nervous because it's going to be a really interesting time with people getting sick. However, I do believe that our society is intelligent enough to reduce this risk by getting as many people vaccinated from the seasonal flu as possible.
Thank you so much to both Krystal Adams and Dr. Jocelyn Slaughter for providing us with this valuable information on why it's so important for all of us to get our flu vaccine. Yes, we might think of, well, we're going to definitely get our children vaccinated, but we all need to get vaccinated as well. And if you all have, again, I want to say thank you to their speakers. And if you would like to see some of the resources we've developed over the last week, you can go to childcareaware.org/flu. And feel free to reach out if you have any questions. And like our speakers have said, if you have any questions specific about the flu vaccine, feel free to reach out to your healthcare provider who can let you know where and when you should get the flu vaccine. So thanks again.